Hello and welcome to Doordarshan Nagaland. This is Top Form, your gateway to information and news on health, health services, healthcare services, your channel for healthy living, fitness, health and hygiene, and of course, making Nagaland healthy and making India healthy. We have with us in the studio Dr. Chilhutio Rutso, MLA 9 Kohima Town AC, and Dr. Kenny Madom, Managing Director, Kohima's Hospital. We are going to discuss on Chief Minister Mobile Operation Theatre, which was launched or inaugurated on 26 January 2025. So, welcome, gentlemen, to Doordarshan. It's a pleasure to have both of you here, and thanks for the time. Well, without further ado, we will jump straight into what is Chief Minister's Mobile Operation Theatre. And for that, I would like to put this question to you, Dr. Ato. What made you think of a mobile operation theatre?
Yeah. You see, I've been doing surgery for more than 2 decades, and I've been part of health camp to rural areas. But I find that without surgery, health camp seems to be incomplete. Yet, surgical health camps are not cheap; they're very expensive. So I've been thinking of having a mobile operation theater since long time back, and this time, with the public's mandate, I've become the MLA of the town, the MLA of all the tribes. So I thought of approaching our Honorable Chief Minister and wanted to tell him about my program, about mobile operation theatre. And since we already have Chief Minister's health scheme and Chief Minister's insurance scheme, I was afraid he might reject, but he readily agreed to my proposal and is willing to sponsor the program. So he has sanctioned some money for us. We have bought our equipments, and the program was launched on 26 January. And now I'm happy that the program, which I've been thinking for more than 2 decades, have been materialized under the able leadership of Chief Minister, Sir Nipu Rio.
I understand the Chief Minister of Nagaland, Mr. Nipu Rio, is very open to innovative ideas, and when it comes to health, I'm sure he must have willingly accepted this proposal as well. But Dr. Kenny, how do you think a mobile operation theatre will be successful?
Talking about our CM-MOT, I have no doubt about the success, especially in the future also, because this CM-MOT is been led by our very dynamic and visionary leader, that is our own Dr. Ato. And since he mentioned about his previous past story also about his dream to do such initiative, and now we have started. And also now see this already we have started, and with the under the able leadership of our Honorable MLA Ato, and also our team. We have a very strong team. So I'm very sure that this initiative will be a very successful one in the days to come as well. And also I would like to mention that to be successful, I would say that we need the cooperations and participations of the public in general, as well as the church bodies or the NGOs, or to that matter the the working healthcare workers like doctors, nurses in various CHCs or the PHCs to coordinate with us, cooperate with us, so that we can have a very good team and have a very successful initiative, this CM-MOT program. And for me, the measure of the success of this program will be the the impact that we give to this our people in the underserved areas.
I see.
That will be the measure of success, the impact that we are giving. So the impact could be either in the socio-economic status, improving the socio-economic status, as well as giving a good health to those people.
Yeah. Dr. Ato been the 9th Kohima town, the AC MLA. This Kohima town is considered the hub of everything here in Nagaland. All the tribes come here in Kohima town. So this dream project of yours, having a mobile operation theater and blessed by the chief minister, this is great. But we also know that we have hospitals across the districts.
Yeah.
The Department of Health and Family Welfare has hospitals across the districts. So why do you think it is necessary to have an OT, mobile operation theater?
Yeah, you see, I myself, I was one time a government employee. I served the medical department for almost 15 years. And what I noticed is that due to lack of manpower, rather the proper specialties, if a surgeon is posted somewhere in a district hospital, the anesthetist is not there. Or the anesthetist is posted somewhere, but there is no surgeons to do the surgeries. And the anesthetists and the surgeons together, it's posted together is very rare. On the other hand, we don't have a sufficient anesthetist to cover up all the 16, 17 districts. So with this mobile operation theater, in collaboration with the district hospitals and community health centers, our target is, yes, taking their help also in delivering service to the rural areas. But at the same time, I'm sure there are junior doctors who are not well exposed to surgeries. There are anesthetists who are alone scared to take up cases with other junior surgeons. So in our presence, if they can be part of our team and learn surgery, the surgeons, the anesthetists getting experience from the senior surgeon, the senior anesthetists, how to tackle cases. And moreover, our team is with the latest gadgets like laparoscopy, endoscopy, and then endoscopic urosurgeries and all. So that way they'll have better exposure, not only the doctors, but even the nurses, the other staff who have not seen the latest surgical procedures will get exposed. And then, as I said, the doctors will gain more confidence. So I thought it is good to collaborate with the district hospitals especially. Yeah.
So basically it's a collaborative effort with a super special surgeon that you are, and you are well known across Nagaland. And for me, I'd still say I'll close my eyes and lie down on the OT table with you, no problem. But yes, your expertise and your experiences, sharing with the young people again who are in this profession and coming together and helping our people in the rural areas, I think that's a great thing. But when we say CM Mobile Operation Theater, CM-MOT, I'm sure you must have thought of some, goals, some objectives. Dr. Kenny, would you like to share with us?
Yeah, so when we talk about the objectives, we usually have around like 15 objectives, but I would like to highlight some of the most important objectives about the CMOT. So one is about this improved healthcare accessibility, like it's bridging the gap between those far-flung areas of Nagaland and giving them the urban facilities at their doorstep. That is one of our objectives. So the name itself says the mobile operation theater. So that is one of the objectives, the easy or improved accessibility to the rural facilities in surgical fields, or maybe to the extent of giving the latest knowledge about healthcare system. And another objective is like giving health equity, like whether people from rural or urbans, we deserve the best health facilities, right? So every rural individual have the right to avail this latest facilities. So another objectives is the health equity. And one objective of our CM-MOT is capacity building. Capacity building can be, the service can be provided to the young surgeons, the young doctors who are, posted in all those remote areas.
I see.
So as our Honorable MLA has mentioned, some young surgeons may not be very comfortable with the new, this latest techniques like laparoscopic surgery and all. So it becomes, a platform for them to also learn. So even if our team is not there in the future, they will continue the legacy, I would say, and then they can give the service. So this way, a capacity building for the young surgeons, young doctors, or even to the other healthcare workers like nurses or the OT technician. Most of them are highly qualified, but they don't have, the exposure to practice in the far-flung areas. So with the team from the CM-MOT and in collaborate with them working together in these areas, they will have a good exposure as well, and in the days to come, they can practice without our presence there. So that is one objective is capacity building, and other objectives of us is, like data collections and also, health talk about maybe various diseases. Talking about data collections, we will be, doing some screening tests like hepatitis, HIV, and of which this record can be given to the department. So these are some of the objectives that we have.
When you're talking about health talks, I think that's where people like us who works for NGOs, we can also come in, join you, and we can't do the surgery, but we can do the awareness talks for NCDs as well, isn't it? Yeah, that's great. So with the Grand Republic Day inaugural of CM-MOT, it was very nice to see in the TV. So far, how many surgeries have you done, and are you satisfied so far?
Yeah, you see, the program was launched or inaugurated on 26th January by the governor. The same day, we proceeded to Melori, being the youngest district. We wanted to help them.
Okay.
And we operated 24 or 25 operations, minor and major together.
I see.
And out of that 20 plus surgeries, I'm so happy that I got the opportunity to operate a 4-month-old child with a cleft lip.
Oh, we saw that in the media.
I would say that at least CM's OT, CM's mobile operation theater has given an opportunity to a young girl.
And you smile to the young girl, yes.
Who will be confident to smile confidently in the near future. And yes, I'm so happy with this program because our next target is we're going to Fetsuro, PAG, Kipiri, and Punro from 21 to 27. And we are getting information that, especially in Kipiri, more than 40 patients have responded.
I see.
For the camp. So maybe in our next tour, we may be operating a good number of cases. Yeah.
I see. So you have scheduled already.
Yes, we have scheduled.
Planned for the next phase of your visit.
Yeah.
So, Dr. Kenny, would you like to recap those schedules? Which are the dates?
So basically, we'll be starting on 21st February from here, and then our first visit will be to Fetsuro.
Fetsuro.
Yes.
Okay.
So from Fetsuro,
so people from Fetsuro they
can avail the service, and we are already getting the informations that some patient have already registered.
I see.
So we'll be staying on 21st at Fetsuro.
Sorry to interrupt here, but registered, how do they register?
So basically, before we go for the next visit to any particular area, we choose that area, and then we informed the concerned CHC or PHC, whichever is available in that area. And not only the healthcare workers, but we are informing the administration as well as the church body and the local, NGOs or the village councils, so that we give ample time to them so that they can, screen the patient as well, and
Okay.
then keep the patient for us. This
I
is
see.
what we did in our previous Meluri visit.
I see.
Yes.
So you need the active support and cooperation of
Yes, sir.
the district health missionaries there.
Yes, sir.
Mhm.
So even in our team, we have a coordinator.
Uh-huh.
Not only medical group is there, but we have like non-medical groups in
Uh-huh.
CM-MOT group,
I see.
and then they are the one who does the
I
coordinations.
see.
In between, we help them, and then but they are the one who coordinates with the other non-medical people, and that's how we plan for the next trip. Yes.
So Futsero is one. The next would
Next,
be
the next day we'll be traveling to Pek.
okay.
Yes.
Futsero, Pek,
Yes.
and
From there we'll go to Kifiri.
Kifiri.
Yeah, and from Kifiri we'll go to Pungro.
Okay.
That is the plan.
I see. So,
So-
Futsero, Pek, Kifiri,
Kifiri
and
Pungro.
Pungro. All the people in Futsero, Pek, Kifiri, and Pungro, if you have any complications and you want to get the hands of Dr. Ato to see you, then kindly register and avail these CM-MOT services. Well, when I saw this CM-MOT being inaugurated, and after talking to Dr. Kenny on this, I was immediately thinking of disaster management because I've had a little experience of working. That's a conflict zone. So I worked with the people in relief centers in the Kuki area, Maite area, and with a little hands-on experience, I was thinking CM-MOT could be a key player in disaster management. Hope it doesn't strike us, but if it comes, is there any plan with regard to disaster management situation, emergency situation for CM-MOT team, Dr. Ato?
Yeah. The name itself is mobile
Yeah.
operation theater. So if there is any disaster where medical emergency arises, we are ready to go to the spot. We're always ready. But at the same time, one thing also we should know that in medical emergencies, golden seconds, golden minutes, and golden hours are there for any injured patient.
Yes.
So for such cases, for example, take Tunsan. Suppose someone get injured in Tunsan due to some disaster. And if that patient can be transported or shifted, if they come towards Mokokchung, and from Kohima, if you push towards Mokokchung, we meet halfway, so that patient can avail the service within 4 hours.
Oh,
Had
time
they-
is safe.
Yeah, if they keep waiting in Tunsan, we'll reach them in 7 to 8 hours.
Yeah.
So that type of mobility, the service can be delivered to the nearest, and to reduce the timing, the patient also can be transferred to in between, sort of thing. But if patient cannot be transferred or transported, then yes, we are ready to go to the spot and give the service. We are ready with everything, even the 24/7 power backup also.
I see, I see. So basically, the CM-MOT in any case of emergencies that the state face, then the team is ready to go.
Yes,
And
yes.
of course, it's quite logical. The saving time is also saving life. Coming from Tuensang to Mokchung, team moving from Kohima to Mokchung, that
Yeah.
would be miracle for the patient who is in need of immediate surgery as well.
Exactly.
Dr. Kenip, would you like to tell us about, you are saying Chief Minister Mobile Operation Theatre, and for many of us laymen, we may not know what are the equipments, what are the things that's needed in an operation theatre, but are you fully equipped?
Yeah, so the name says Chief Minister Mobile Operation Theatres, and then yes, we are actually fully equipped with I would say the latest surgical equips, and then it's we are giving all the services on like keyhole surgeries, then even for endoscopy, then we have all the equipments ready for dental department, and any eye surgeries or eye problem, even ophthal, we can tackle that. Then we have equipments all ready for what they call gynae department for gynecology. So I think we covered almost all the department in our team.
see.
Yes, so I would say we are fully equipped and we are ready to handle any kind of case.
I see. So, if I'm to put it in terms of naming services for our common people services, then what will be the services? Let me put it this way, simply in Nagamis. Hardy laga problem thaga kan ahile hardy la service pawna na pawo.
Yes, you will definitely
Acha,
get for
apni
that also.
gaini koise to gaini
Gynae
bole to
is-
maiki.
Yeah, for female, any pregnancy issues or any womb problem or yeah, anything related to female, we have the service for
see.
female. Then talking about ortho, we have ortho doctor also in the team.
I see.
So anyone with fractured bones or anything to do with spine, we have ortho doctor to handle that also. Then we have the surgeons to do any surgery that comes in the the eyes of the camera inside your stomach. Any structure that comes inside the the view of the camera, we can do the surgery for that also. Yeah.
Okay, that's pretty beautiful. So, dear viewers, it is important to note here. Jodi apnar laga jagate CM-MOT service ahishe koile ahibule ase na nai itu kan bi contact kurule paribo aro khobor logine apnar ki bimar hoile bi mohan Nagamis te do iman simple hoy jay ki bimar hoile bi apnar complaint thakise ana hoise gole do CM-MOT laga team logo jagine takhan kode ahi ase tate jagine itia tu futsero phek ki firi aro pungro de ahi bula ase apnar khan tate thaga manu khan bi itu jani thakine date khan hudilibi apnar district hospital khan de nole community health centers khan de khopor loise gole do jani lobo na grugine itu service lobole lagibo bimar thakile nohole mohan next time he sabo itu bar digdar as a excuse kuri thakile bimar do aro dangor hoy jay edu karne edu bal bra babi thakine loile bal hobo. Well, I am also curious with sustainability because the chief minister being kind and innovative and he's willing to help his people here in Nagaland, but after one-time grant, how are you going to sustain this initiative?
So, as mentioned, like it has been an initiative, a blessing from our CM, and then we have started our CM-MOT, and then in the days to come also we will try to avail the like actually this services is for any person who has this our Ayushman card or CM-HI's card, whether they have the card or they don't have the card, we are going to give the service free to any needy who needs the care. But those patient who has the card, Ayushman card or the CM-HIS card, we will avail the card, and then whatever little amount that we get from that card will also help us to sustain this program. So this is what we are thinking, and also with the visionary leaders like Dr. Ato in the team, I'm sure in the days to come there will be more ways and means to sustain this program. This is what I believe, and with the maybe the good result and the good outcomes from this initiative and the good feedback from the public, I'm sure the government will also look into it again for the future sustainability of this program. This is what I believe.
In fact, not only sustainability, upscale it,
this is what, because this is another dream of us, to, not only in the state of Nagaland, but even it expands beyond Nagaland, so that even other states adopt this kind of similar programs to help the far-flung areas of their states. This is
our success is, the success in Nagaland, CM-MOT success in Nagaland should be duplicated in other beyond the borders of Nagaland as well. And in fact, when the Dr. Ato has the intention, it is his brainchild and his baby, because I have also attended one of his outreach surgical camp in the far-flung areas. It was interesting. So these efforts, if is done well, then definitely it should be, you know, upscaled, and I'm sure the Chief Minister would be happy to upscale this one. So, but as is the curious mind again, I wanted to know about the staffing, CM-MOT staffing. Do you have a system to get your staff, or are you taking volunteers? Volunteers in the sense doctors and nurses, or paramedics, or any volunteers? How are you going about this?
Yeah. Regarding the staffing pattern,
Uh-huh.
as of now, we are taking mainly from Kohima's hospital,
Uh-huh.
technicians and doctors and nurses.
Mhm.
But before we go to the place where we are planning to go, we ask the type of cases that are being registered.
Uh-huh.
As you were asking earlier about ortho,
Mhm.
if ortho cases are there, we will try to call the orthopedic surgeons.
Mhm.
And on their behalf also, we can ask the medical college dean or the principal director of the medical department
Uh-huh.
to grant leave for them for 2-3 days,
I see.
so that they can go and give the expertise.
Uh-huh. Uh-huh.
So like that, anesthetists or surgeons, in case we need any additional,
Mhm.
we can always take the service of either in-service or just private practitioners
Mhm.
who are willing to give service to the public. We'll definitely
Mhm.
invite them, and I'm sure many Nagas, they will definitely agree to such service. I'm very sure of my colleagues.
Yeah, definitely. People should volunteer for such noble effort that the CM-MOT is trying to achieve. We are running out of time now, but just wanted to ask this one, and maybe all our viewers also wanted to know, because Nagaland is also not very famous for, you know, cleanliness and hygiene and all those things. But when it comes to operation theater, and that too in a mobile setting, how do you maintain the, in our common people's term, cleanliness or disinfection controls? How do you get these things done?
So we are well equipped with all this sterilization procedure as well. So whether we get CHC or PHC places to operate, or we don't get a place, and then if we are meant to open the pitch a tent and do operate in a playground also, still we are fully equipped with all the sterilization procedures, equipments. So these days we have autoclaving as well to sterilize our instruments, and these days we have a wonderful sterilizing liquids that comes. Before it takes around 20-30 minutes to sterilize our instruments, but now these days we have all the chemicals that we can use to sterilize our instruments within like 5 to 10 minutes.
I see.
And we are equipped with all these sterilizing what do you call the equipments and chemicals in our
I see.
setup.
So,
yes.
So in short, it's like saved. You're taking all the necessary steps to keep the patient safe and have a successful outcome with your
Yes.
surgeries. Well, final question for those people who are watching and those who would like, to be part of this. This is a very noble venture, or rather initiative, and I'm sure many people would like to associate with this initiative. In fact, I'm already thinking if I can rope in my team and be part of this initiative. But is there any scope available for any other people any other NGOs or civil societies who would like to be part of this or be of assistance to this initiative of CM-MOT?
Yeah, you see, especially yourself, being already running a program called the Family Planning Association of India.
Yeah.
See, when it comes to family planning, the planning, the procedure part can be done by a surgeon or by a gynecologist. It is not a big deal. The question is convincing the mother to undergo the procedure, which can be done by people like you, your team. So the harder portion is covered by you, and the easier part we can take up. So definitely you can be part of our team. And other sectors in the medical department also, those like NSAIDs, they can also come and be part of the team, so that they can screen our patients who are likely to undergo surgery, screen them who are positive, who are not positive, and also at the same time get on the ground get the proper data.
Yes.
The out of 100 screen, how many are positive? They can get proper data also. They'll be part of our team also.
Yes.
So yeah, so many other units, as I said, your family planning unit or NSAIDs unit, definitely can be a part of our team. We would like to avail this service. So in the next program, as I said, from 21 to 27 of February,
yes,
if your team is free to join us,
yes,
you're most welcome.
We would be. Dr. Atop, it's a beautiful thing to be talking to you always, and I wish you good luck with your baby, CM-MOT, and Dr. Kenny, he's like your shadow. I see you two all together all the time. I wish you two good luck, and to the team of CM-MOT, we wish and we pray that these good hands will reach out to all the people in the rural areas as well. Thank you so much for joining me in this discussion, and we hope to see you in future as well. Thank you.
Thank you. Okay. Thank you.